doctor this morning, and it starts this 2.5-hour runaround. And the conclusion I have is no one has tests.
Cheryl doesn't want us to use her last name, but she does want us to find out why she can't get a coronavirus test.
I'm sorry. They told me to call the health department.
We talked with Cheryl by FaceTime because she says she has COVID-19 symptoms, including a fever, dry cough, and trouble breathing. She's also in 2 high-risk groups, over 60, with a compromised immune system.
Hopefully I don't have it, but I don't know. If I do have it, I don't want to infect all these people. But with no way to get a test, how do you know?
Call your doctor's office if you believe you may have the novel coronavirus.
Within hours of that statement, call logs confirm Cheryl called her general practitioner's office, which she says gave her a coronavirus hotline for the hospital physicians group. She says the hotline told her they don't have any tests yet. Cheryl called her county and state health departments, which she says referred her to the CDC in Atlanta. She says the CDC insisted only her general practitioner could order a coronavirus test, so she called back. The doctor's office recommended she call her employer. After 2.5 hours on the phone, still no test.
It's a vicious cycle. Call here, call here, call here, call here. Everybody's referring you around.
I'm calling to see how I could get tested for COVID-19.
We called some of the same numbers and got the same answer: no testing.
When we look at COVID-19, it's gone around the world in about 2 months.
University of Georgia infectious disease expert Dr. Jose Cordero says we should be testing people like Cheryl. And she's already self-quarantined because of a suspected case at work. Is that someone you would want to see tested?
Well, if we take the recommendations, the current recommendations of CDC, she would qualify for testing.
Coronavirus is now spreading in communities in the U.S., leading the CDC to allow doctors to order tests based on symptoms alone. But the physicians group hotline we and Cheryl called is still asking about foreign travel as a prerequisite for testing. Testing they say they're not yet set up to do.
And the first question out of everybody's mouth is, have you been exposed to someone that's had a positive test? Well, that's craziness because they don't have tests available.
The United States now is an affected country.
A system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Nations like South Korea are testing tens of thousands of people every day. In 2 months, the CDC and state health departments are reporting testing only 11,078 samples.
That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it.
This is the battleground in the fight against COVID-19, one of dozens of labs where samples are tested for the virus.
But the reality is that these tests do take time.
Any doctor can use standard swabs most of their offices already have.
And I'm going to have you tilt your head up just a little bit.
Here's the process. They take 2 swabs of each patient, one of the nose, one of the back of the throat. Those are frozen and shipped to either a CDC lab, state health department, or a commercial lab like Quest or LabCorp. Right now, tests are processed within 3 or 4 days before the results are sent to your doctor.
Okay, we should have the results back in the next 3 to 4 days.
The sample arrives one day, it's tested the next, but you also have to have another day or 2 to get the report back.
Where are the test kits? Why don't doctors have them? Because it's not a kit sent to your doctor, it's a test the lab uses. It's not a blood test, but a standard swab. You can't be tested at a government or commercial lab. They're just processing the swabs collected by medical staff around the nation. The results are not instant like a flu test. It takes hours to run each sample.
Ideally, we all would like to have a rapid test that could be done at the bedside. We don't have that.
And that means the results are out of date the moment they arrive, confirming only that the patient tested negative 3 or 4 days earlier. Where are the tests? They're here in commercial labs like this one all over the nation. Life Hope Labs, just miles from the CDC, is actively running COVID-19 samples and reported its first positive case more than a week ago. But the samples are coming in at a trickle.
We're prepared and ready to go, and we are under our capacity currently.
So I called my doctor this morning, and it starts this 2.5-hour runaround.
We've been reporting about patients with symptoms getting turned away from doctors' offices, hospitals, state health labs, and the CDC, unable to get swabbed for COVID-19.
Healthcare providers, they don't want infected people coming to the clinic.
The doctors who are swabbing patients are using back entrances and protective gear to collect each sample.
And I'm going to have you tilt your head up just a little bit.
If we infect our healthcare providers, the system will shut down. That is a scary thought to me.
The risks are high and the payment is low. Healthcare providers tell us some insurance reimbursements aren't yet covering the lab's cost to run the expensive genetic tests for coronavirus. The federal government has promised free testing for all, but there's no mechanism for labs to recoup costs from the government right now.
We can do 846 per day. That's our capacity right now on a 12-hour shift. We could double that capacity if we double our staffing, but right now we haven't had the volume request.
They went to the health department, they turned them away. They went to their local doctor, they turned them away. And then they went to the CDC. They said, go back to your local doctor.
Jody Stewart thinks she has found the solution. Deliver swab kits overnight directly to patients' homes.
This lab has been heaven sent. I reached out to Tim out of desperation. He's like, no, we've got plenty of tests. You know, we can ship them right to their home and we can get the results to your doctor within 24 hours.
We FedEx it, overnight it to them. They're self-administering. Currently right now, they put the kit back here on ice and it's overnighted back to us.
And infected people never come in contact with a hospital or a doctor because Stewart runs a national travel and corporate healthcare company, Vaccines to Go, with telemedicine doctors in all 50 states.
Our MDs actually call with negative or positive results.
It takes 4 hours to run the test and they can process 46 at a time in each machine. But all of this lab equipment and staff costs money.
We've been running probably half our tests that we haven't been paid for or not getting paid for.
The lab and the logistics company say they could start shipping these kits to thousands of people immediately with a one-day turnaround, but only if they get government assurances of payment. They say they can't get state and federal officials to even return their calls.
You're willing to do this at a loss if you have to?
We are, me and Tim both. The lab is doing it at a loss and we are too, because we've got our patients and we've got people who are reaching out to us, you know, basically some of them even crying on the phone because they have been turned away and they don't know what to do.
Journalist Nicole Vapp never wanted to become the story.
Just gave all my information and they gave us a testing kit.
She leads the investigative team at 9 News in Denver. But now she's being investigated for COVID-19 because of symptoms and contact with someone who already tested positive.
Okay, one more to go. We got this.
The drive-through tests keep potentially infected patients out of hospitals, away from vulnerable healthcare providers and each other.
Okay.
But these instant tests don't come with instant results.
It said it would be 72 hours. Even though my doctor told me it'd be 24, they said it would be 72. And I still haven't had results.
The vast majority of tests currently conducted in the United States are genetic. The patient is swabbed and then that sample is sent to the lab, which copies the DNA to match it against the genetic fingerprint of the coronavirus. It's a 4-hour test that typically takes days between the moment the sample is collected and when the results are sent to the doctor. The genetic test shows only if the virus was in your body at the time the sample was taken.
We're just sitting here waiting.
Nicole got no answer for 5 days. Then, right after this interview, she got the news. She was negative.
If someone's getting a test result back 5 days later, it just tells them they were negative 5 days ago. It doesn't tell them they're negative now.
Exactly. It's kind of a useless test at that point.
Some countries are using a test that involves a blood draw. The blood is sent to a lab which doesn't detect the virus itself, but looks for the antibodies we produce to fight the virus. That test takes the lab a few hours before the results are sent to the doctor. The antibody test shows if the patient has ever had the virus, including people who have recovered and would otherwise otherwise show up negative on the genetic test.
There's so many people that could have this that are running around.
Researchers around the globe are racing to develop an instant test that could be used in a doctor's office or emergency room with immediate positive or negative results. For now, here in the U.S., the people who can actually get in line to wait for a test then have to wait days longer to hear the verdict.
Well, they diagnosed it as pneumonia.
Add Melissa Spielholtz to the list of at-risk patients who can't get a COVID-19 test.
You would qualify for a test under the current protocol, right?
I've had symptoms that are very textbook to what they're saying the symptoms are, and they're not testing me. So how many of me are there out there?
These are some of the signs outside doctors' offices warning the sick not to enter. Some send patients to state hotlines.
You can't get a human on the phone. It basically directs you back to your physician, and then your physician directs you to the hotline. I mean, it was an absolute circle.
The reproductive rate of the COVID-19 virus with minimal interventions is expected to be around 2. That means the average infected person can be expected to infect 2 more people. But that progression isn't 2, 4, 6, 8, 10. The number is compounded. That means one person infects 2 people, 2 people infect 4 people, 4 people infect 8 people, 8 people infect 16 people, 16 people infect 32 people, 32 people infect 64 people, 64 people infect 128 people. That means if one infected person who doesn't need medical attention stays out of the hospital, out of the doctor's office, stays at home, they can keep themselves from infecting hundreds of people.
Millions of people are heeding the call, staying inside from coast to coast, with some cities and entire states ordering their citizens to shelter in place indefinitely. The guidelines for testing are inconsistent. It's up to your doctor, but there's no requirement that any office or facility has to offer coronavirus testing.
The fact that one of our biggest hospital groups is only testing employees speaks volumes. They don't want the healthcare workers to get sick, which, while it's understandable, it's not doing the public any good.
Melissa ultimately got an at-home swab kit, which the lab picked up in person. Self-tests are not yet FDA approved, but some at-risk patients with symptoms say they're left with no other choice. In Atlanta, I'm Brendan Keefe,